I guess that's everybody. Stand back over there, maybe, so I can. Okay. That's good. You can sit down. Hello, my name is Jamie Anderson. I'm giving a class today on how to start IVs. I guess the normal place to start is who is able to start IVs. There are a number of people who are able to do this type of thing. RNs, paramedics, EMTs, doctors are all allowed by the state or governing bodies to do IVs. There are a number of reasons also why they're able to do IVs. One reason that they're commonly used is for the administration of pain medicine, for fluids, or for IV antibiotics. Now let's begin with what we do to start an IV. The first thing that we need to do is find an acceptable site for starting the IV. The most common place for doing so is in the hand or in the AC or the antecubital fossa, which is at the bend of the arm here. These are all good sites, but they both have reasons why you may not want to use them. The top of the hand, for instance, if the patient is elderly, this place might, the veins, the vasculature of that area may not be as good as it once was. Also in the bend of the arm, this area at times could be uncomfortable for the patient in case they need to bend their arm, the IV may not flow anymore. Once you find the location, first we need to apply the constricting band to the site. Applying the band there allows the venous flow to enter the arm, the arterial flow to enter the arm, and the venous pressure not to leave. This makes the veins rise to the surface a little bit better. There are a few tricks that may help us find a good vein in the site that we're trying to find one in. One of those is by using the normal blood flow of the body. We can use gravity to our advantage. If you hold your arm down that you're looking at, this would allow the normal gravity to pull the blood to the areas and make the veins stick out a little bit better. You may also tap it with a finger. This causes a bruise to the area, and with that it would help the blood increase to the area as well. When preparing the site, you would want to take an alcohol pad. They usually come pre-packaged. You would usually use a circular type motion to clean the site. You would start on the inside and work your way out. This would relieve any infectious agents to the outside of the area. Now we need to talk a little bit about equipment that we might use. The one that everybody's probably most familiar with is a needle. They can come in different sizes, usually ranging from 24, which is the smallest, to a 22, which is a little bit bigger, all the way up to a 14 gauge. The 14 gauge is used for administration of massive amounts of fluids usually. There are also different types of tubing that may be used. Usually you would use a one size tubing if you need to give lots of fluids as compared to a smaller amount of fluids or drugs. You may use a smaller size tubing. There are also many types of fluids that may be administered through the IV tubing and sets. When we're talking about insertion of the IV, there's a bevel on the needle that points upward as you're doing the insertion. In this day and time, most of the needles used have a protective system to keep people from getting stuck by a dirty needle. With this in mind, they have different types of mechanism which will allow the retraction of the needle back into the hub. When we do the insertion of the needle, we find the site, we cleanse it. Once we have it cleansed, we do the venipuncture. We actually stick the needle into the vein. When the needle enters the vein, we will see a small drop or two of blood that enters into a flash chamber. Once that is entered into there, we proceed with the needle just slightly further. We go in, of course, at a 45-degree angle. Then we advance the plastic catheter into the arm. We remove the needle from the person's body. At this point, the venous area has been accessed. Once we have venous access in place, we hook the IV tubing to the catheter itself and proceed to tape down the site. There are a number of different methods used for taping down the site. It doesn't really matter which one as long as it is taped securely. There are several dangers also that could be involved with doing an IV. One of them is infection of the site, which usually results in an infection of the vein itself. These are usually cured with antibiotics. Also, if you happen to go through the vein with the needle, you could cause the fluid or medication to go into the space around the vein area. This, in some cases, could cause destruction of tissue. In this class, we have learned how to start IVs and to do intravenous access. It is a great responsibility for all of us to sharpen our skills and become better at what we do. If we do not, harm may come to the patients that we serve. Perhaps with all this in mind, we can save more lives. Thank you.